Many couples had their IVF or FET cycles canceled during the first wave of the COVID-19 pandemic. Now that your doctor has resumed treatment, what things should you check for to make sure you are safe? Stay tuned and I will go over the list with you. Number 1, the waiting room. The major route of transmission for COVID-19 are respiratory droplets from other people that are close by. The more people you are close to, the higher the chance that you will become exposed and infected. Ask your doctor's office about waiting room protection. Are there multiple other patients in the waiting room at the same time as you? If there are, leave. The best way to minimize your risk is a virtual waiting room. The concept is easy. When you get to your doctor's office, wait in the car. Notify your doctor's office you have arrived and wait for them to tell you that the waiting room is empty and has been cleaned from the last patient. At IVF One, we use an app on your mobile phone to be notified when the patient has arrived, and we can then notify them by text message that it is safe to enter. Our patients can even see where they are in line and an estimated wait time. Number 2, masks. Everybody should be wearing a mask at all times, the staff and the patients. Number 3, hand washing. If somebody coughs into their hand and then touches the elevator button, it is now contaminated. If you touch it, you could pick up the virus. Make sure your doctor's office requires all patients and staff to wash their hands with soap for 20 seconds immediately upon entering the office. Number 4, screening. The best way to avoid transmitting COVID-19 is to make sure that nobody who has it is there in the first place. The office should ask a series of questions of everybody who enters the office to assess their risk. Anyone who is at high risk should not come to the office. At IVF One, before patients can check into the office, they must answer these questions first. If they are at higher risk, they can't check in. Number 5, temperatures. Right at the front door, everyone should have their temperature taken. Anybody with a fever should be sent home. Number 6, social distancing. Everybody knows by now to maintain at least a 6-foot distance from other people. When you are doing IVF, there are a few times when this is impossible. During monitoring, the biggest risk is when you are getting your blood drawn and when you are having an ultrasound. The blood drawing chair is the riskiest time because you are literally sitting face to face with the phlebotomist for a few minutes or more. At IVF One, we have placed medical-grade HEPA filters at face level right between the patient and the phlebotomist. This will reduce the amount of viral particles in the airspace between the two of you and help reduce the risk. We also use bipolar ionizers. This is a technology that adds an electrical charge to the particles in the air so that they clump together and fall to the floor or make it easier to get removed by the filters. Number 7, the procedure room. Another time when your risk is greater is when you are in the procedure room for your egg retrieval or embryo transfer. When people have anesthesia, they are prone to coughing, and some methods for giving anesthesia can cause viral particles to go into the air. This is called aerosolization. If you have ever seen sunlight in a room, you may notice tiny particles floating in the air. These are called aerosols, and they can stay in the air for a long time. Although this does not appear to be a major way in which the virus is transmitted, there is some scientific evidence that it is possible. There are a few ways your doctor can help protect you. Opening the window to let fresh air in is easy, but most IVF procedure rooms don't have windows. Another method is to have a gap in between procedures to allow the air handling system, or HVAC, to exchange the air with clean air. Finally, using mobile HEPA filters and bipolar ionizers in the procedure room and pre- and post-procedure areas may help minimize the risk. At IVF One, we space our procedures and used ionizers and filters. Number 8, testing. Current evidence suggests that many people who carry the virus may have no symptoms or minimal symptoms. It is recommended that all patients who are going to have a procedure with anesthesia, like an egg retrieval, should have a COVID test to look for the virus within 2 or 3 days before coming in. Nothing will completely eliminate your risk if you venture out of your house, but by making sure your IVF center does all of the above things, you can minimize your risk. For more information about IVF, check out this playlist. If you like this video, remember to like this video and subscribe to our channel now. Infertility TV releases a new episode each week. It's like having a fertility doctor in your phone.